4 philosophies on how to approach your health. Most people's healthcare strategy is a reaction. Something hurts, they Google it, they take something for it, and they move on. I want to walk you through a different way to think about this. 4 philosophies. This is the actual order I think about my own health, and it's the order we built our clinic around. Let's go through them. Philosophy 1: prevention, prevention, prevention. The best treatment in medicine is the one you never needed. That sounds obvious, but almost nobody actually organizes their life around it. Prevention isn't a supplement or a hack. It's 4 unglamorous things done consistently. Eat right, whole foods, real protein, minimal processed junk. Not a diet, a baseline. Exercise. Movement is closer to a universal medication than anything in a pill bottle. It touches your cardiovascular system, your joints, your hormones, your mood, all at once. Time in nature, sunlight, fresh air, natural movement. Your body evolved outside, not under fluorescent lights. Good relationships. This one gets ignored constantly, but the research is remarkably consistent. Strong social connection is one of the single biggest predictors of a long, healthy life. Isolation is a health risk in its own right. None of these 4 are exciting. That's the point. Prevention wins through boring consistency, not intensity. Philosophy 2: avoid environmental exposure. The second philosophy is about what you're not putting in and on your body. We live surrounded by synthetic chemicals that our grandparents never had to deal with, and a lot of them go completely unquestioned because they're in every store. A couple of examples I pay attention to: laundry detergent. Most conventional formulas are loaded with synthetic fragrance and water softeners that are carcinogenic. These chemicals that sit against your skin, your body's largest organ, for hours a day. Aluminum in deodorant. Antiperspirants use aluminum compounds specifically to plug your sweat ducts. That's an active ingredient sitting right next to your lymph nodes, absorbed through skin daily for decades. Aluminum plaquing in the brain is a real thing that causes types of dementia later in life. And it doesn't stop there. Non-stick cookware coatings, plastic food containers, synthetic air fresheners and candles, pesticide residue on conventional produce. Individually, small exposures. Cumulatively, over a lifetime, it adds up to a real chemical load your body has to process. I'm not telling you to panic. I'm telling you to get curious, read labels, swap what's easy to swap, and reduce the load where you reasonably can. Philosophy 3: a stitch in time. Old saying, a stitch in time saves 9. Deal with a small problem early, and it stays small. Here's how that applies to your health. When something does come up, don't guess and don't wait. Get a diagnosis first, then treat. I see this backwards constantly. Someone feels a symptom, and instead of finding out what's actually happening, they jump straight to masking it. That's treating blind. You end up chasing symptoms instead of solving problems, and small, easily fixable issues get the chance to become big, complicated ones. Diagnose first. Know what you're actually dealing with, then treat the right thing the right way. Philosophy 4: start least invasive, least costly. Every time. This is the philosophy our entire clinic is structured around. When you have an issue, don't start at the top of the intervention ladder. Start at the bottom, and only move up if you have to. In our office, that ladder looks like this. 1. Chiropractic and acupuncture first. Low cost, low risk, addresses mechanical and neurological issues directly. 2. Move up to shockwave or laser therapy if the first 2 are not enough. Still non-invasive, more targeted, but higher cost. 3. Move up again to PRP or stem cell and exosome therapy if needed. Regenerative, biologic, working with your body's own repair systems. Not terribly invasive, but the cost is much higher. There are a lot of other things that may work for you, like physical therapy or massage. Only after exhausting that ladder do I think it makes sense to lean on drugs or surgery as the answer. I want to be clear about why. Medications may save lives, but every drug is, functionally, a controlled poison. It doesn't just go to the one spot you want it to, it circulates through your entire system and creates side effects wherever it lands, some of which you won't feel until years later. Surgery works, and sometimes it's exactly the right call, but it also comes with real risk: infection, anesthesia complications, scar tissue, recovery time, and outcomes that aren't always guaranteed. Once you cut, you can't uncut. I've had times in my life that both were the right choice, but they were the last resort for me. None of this means drugs and surgery are wrong. It means they should be the last answer, not the first, used when everything less invasive has genuinely been tried, not skipped because it's slower or because insurance doesn't reimburse it as easily. Recap: prevent first, reduce what you're exposed to, diagnose before you treat. And when you do treat, start at the bottom of the ladder, not the top. This is how I handle my own health, and this is how we do it for our patients at Infinite Chiropractic and Regenerative Medicine.